Imagine living with a voice in your head that never stops, a voice constantly telling you to check, double-check, repeat, and doubt. You know the voice doesn't make sense, you know everything is fine, yet you can't ignore it. That's the reality for millions of people living with OCD, or Obsessive-Compulsive Disorder. For so long, many of us have thought OCD was just about being a neat freak, someone who loves order and cleanliness. But the truth is far more complex and often painful. OCD is a serious anxiety disorder that can disrupt daily life, strain relationships, and exhaust the soul. Yet there's one part we rarely talk about: the way OCD symptoms can show up differently in men and women. These differences not only shape how the disorder appears, but also how society perceives, diagnoses, and treats it. In this video, we're going to unpack those layers, not to compare, but to understand. Because understanding is where empathy begins. And empathy is where healing starts. A deeper understanding of OCD. Obsessive-compulsive disorder consists of two main components: obsessions and compulsions. Obsessions are intrusive, unwanted, anxiety-inducing thoughts or images. Compulsions are the actions or rituals someone feels compelled to perform to ease that anxiety. For example, someone might obsess over the idea that their hands are covered in deadly germs. To quiet that fear, they wash their hands repeatedly, even until their skin is raw. Others might experience disturbing thoughts about harming someone they love and respond by avoiding sharp objects or refusing to be alone. What's important to understand is that people with OCD don't enjoy these thoughts. In fact, they often feel ashamed, guilty, or even disgusted with themselves. They're fully aware that their fears are irrational, but that doesn't make them any easier to control. Many also face deep frustration. They feel isolated because few truly understand what they're going through. Even among their closest friends or family, they can feel completely alone. That's what makes OCD so emotionally draining. Not only are you battling your own mind, but you're also trying to hide it from the rest of the world. And the fear of judgment only makes things worse. For many, opening up about OCD means risking being misunderstood or even mocked. They might hear comments like, "We all have a little OCD," or "just stop overthinking it," as if their pain was a quirky personality trait rather than a debilitating condition. This kind of casual dismissal can deepen the feelings of isolation and make people less likely to seek help. OCD in men. Statistically, OCD tends to appear earlier in males, often during childhood or early adolescence. Boys might start showing signs like arranging toys in a specific order, repeating phrases before bed, or performing rituals before leaving the house. Sadly, these behaviors are often brushed off as quirks or just part of being a weird kid. As they grow up, men with OCD often display more visible compulsions. They might repeatedly check doors, windows, or car locks. They might do the same task over and over until it feels just right. Some struggle with extreme needs for symmetry or order. But there's a darker side. Men are more prone to having aggressive, sexual, or taboo obsessions. They might experience unwanted thoughts about harming others, committing violent acts, or sexual ideas that go against their values. It's not because they want to act on these thoughts. Their minds are simply weaponizing their deepest fears. The issue is, in a culture that tells men to be strong and unemotional, many of them feel ashamed to seek help. They worry about being seen as weak, strange, or even dangerous. So they suffer in silence, sometimes masking their symptoms with alcohol, anger, or other compulsive behaviors. Even worse, this stigma often delays diagnosis. Men may not seek professional help until their OCD becomes overwhelming, when it's already damaging their careers, relationships, or even their safety. That delay can make recovery harder and may lead to additional issues like depression or panic disorders. Another factor is how men are often socialized to seek control and dominance over their environment. When OCD makes them feel powerless, this contradiction can lead to even more shame and distress. They may overcompensate in other areas of life, working obsessively, becoming hyper-controlling, or avoiding vulnerability altogether. In therapeutic settings, clinicians also need to recognize how male OCD may be masked by anger, substance abuse, or avoidance. Without sensitive assessment tools and awareness, these individuals can be misdiagnosed or overlooked altogether. OCD in women. Meanwhile, OCD in women usually begins a bit later, often tied to hormonal shifts like puberty, menstruation, pregnancy, or menopause. These hormonal changes are believed to intensify OCD symptoms, especially for those already prone to anxiety. Women tend to experience more internal, hidden obsessions. Many deal with what's called puro, where the compulsions are mostly mental. For example, they might have recurring thoughts about doing something immoral, harming their child, or making a catastrophic mistake. Their compulsions might include mental checking, repeating prayers, or seeking reassurance from others. Because these behaviors aren't as visible, they're often overlooked. Women with OCD are frequently misdiagnosed with generalized anxiety, depression, or even personality disorders. But what they're experiencing is classic OCD, just in a different form. Even more heartbreaking, many women are afraid to share what they're going through. They fear being labeled a bad mom, an unstable partner, or just plain crazy. But what they really need is support, not judgment. The fear of stigma can drive them into isolation, creating a vicious cycle of guilt and anxiety that's incredibly hard to break. In some cases, OCD in women intensifies after childbirth. This is known as postpartum OCD. A new mother might be tormented by thoughts of harming her baby, even though she loves her child deeply. These thoughts are terrifying, and they often make her feel like a monster. But again, these are symptoms of a treatable disorder, not reflections of who she truly is. Additionally, women may develop compulsions that center around being a perfect caregiver, homemaker, or partner. This can manifest as excessive cleaning, organizing, or caretaking behaviors that are actually driven by fear rather than choice. Society often praises these behaviors as being responsible or devoted, which can make the underlying OCD harder to identify and treat. Biological and cultural differences. Beyond symptoms, biology and culture both play huge roles. Research suggests that brain structure and how the body responds to neurotransmitters like serotonin may differ between men and women. But beyond biology, societal expectations matter just as much. Men are raised to be independent, tough, and emotionally reserved. So when they feel fear because of OCD thoughts, they suppress it. Women, on the other hand, are taught to be moral, nurturing, and responsible. So when they have intrusive thoughts, they feel crushed by guilt and shame. Gender roles in our society often leave people with OCD unseen, unheard, and misunderstood. We need to approach OCD with more inclusive, personalized perspectives, not just based on clinical criteria, but also through the lens of each person's social and emotional context. It's also crucial to recognize how cultural messages often minimize mental health. People are told to just be strong or pray harder instead of seeking professional help. As a result, many people feel like failures when their OCD doesn't go away, as if it's a moral weakness, not a medical condition that can be treated. Further complicating this is the intersection of gender with race, class, and religion. A woman from a conservative background might fear spiritual consequences for her thoughts. A man from a working-class background might feel that therapy is a luxury he can't afford. All these elements matter when we talk about OCD treatment and awareness. The journey to recovery. OCD is a serious disorder, but here's the good news. It's treatable. Cognitive behavioral therapy, CBT, especially using exposure and response prevention, ERP, has been proven to help people face their fears and resist compulsions. Medications like SSRIs can also help balance brain chemistry. But recovery isn't just about therapy. It's also about support from family, partners, friends, and communities. We all have the power to help. By listening without judging, by understanding that these struggles aren't choices, and by creating safe spaces for people to open up. In recovery, it's also important to know that setbacks happen. Healing isn't a straight line, it's a journey full of ups and downs. There will be good days and there will be hard ones. But with consistency, patience, and ongoing support, OCD can be managed and life can get better. For many people, finding a community that understands their struggles is a game changer. Online groups, local support groups, or even one friend who truly gets it can offer strength and validation. There's also value in telling your story. When people share their OCD experiences, whether publicly or privately, they help chip away at the stigma. They give others permission to seek help. They remind us all that mental illness is not a sign of failure, but of humanity. And to you, if you're battling OCD, you are not alone. You are not dangerous. You are not broken. You are a human being facing a very real disorder, and you deserve help and healing. Seeking help is not weakness, it's one of the bravest things you can do. OCD doesn't wear just one face. It has many forms, many voices, many stories. And those stories differ from person to person, including between men and women. By understanding those differences, we can create safer, more empathetic spaces for everyone affected by OCD, no matter their gender. When we open our eyes to these differences, we grow not just clinically, but emotionally. Because behind the OCD label is a person who deserves to be understood, not judged. If this video helped you learn something new, don't forget to like, subscribe, and share it. Someone out there might desperately need this understanding, and you could be their bridge to hope. See you in the next video. Stay strong, stay aware, and stay kind. Because a more empathetic world starts with us.